Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. So I want to do a little bit of a recap from the Retired Teacher Chapter meeting, the first one of this year. We were very excited to have been invited to come and speak, and I say we, as it was myself, as well as Jake Gardner, one of our litigators in our cases protecting the retirees' health benefits. So he and I both were there to speak to all of the retired teachers and let them know the official update of all three of our litigations against the City of New York to protect the promise that was made to us and preserve our access to traditional Medicare with our senior care supplement. So I want to make a series of short videos because this was a long, about 30-minute segment, and I don't want our videos to be that long. So for focus, I'm going to break down each question as I can, and then we will address each one. So first, I want you to hear that after we made the presentation of the update of all three cases, the floor was open to questions. And the first question was from Ms. Nina Tribble, a retired teacher. And I'm going to share with you her question, and then you'll hear my answer. And I'm also going to add more to that now. So hang on.
Thank you. I just Nina Tribble, retiree. I know you mentioned several lawsuits. My question concerns the one that I testified personally at for City Hall to amend the administrative code. I don't know the number, 25-126, but I want to know why your organization did not choose to do that, because we would have had choice instead of HIP and what we're given.
I'll let Marianne answer. So that doesn't involve the lawsuit, that involves legislation.
Right. So what you were asked to testify to was a mayoral initiative, which was a law that would have put in control the Municipal Labor Committee to choose which plan they would feel was suited for you. Right now, the law reads that the city will pay the full cost of health insurance up to the HIP HMO rate for every employee, retiree, and their dependent. Since the 1992 health agreement that was reached by the unions and the Municipal Labor Committee and the City of New York, you have choice. You have a choice as a retiree of 14 plans today, and as an active worker, you have a choice of 11. And it is because of that statute that there is choice. The city cannot diminish a health benefit or change benefits unless the unions and the MLC agree to it. So when you were testifying, you actually testified that day. Your testimony was that you wanted your traditional Medicare. What 874 was going to do was allow the Municipal Labor Committee to choose which health care plan that they sought fit for any class of individuals. Right now, the choice is yours. Later, that is absolutely true, Bridget, I'm sorry. And actually, that law, 874, was not taken up by the City Council specifically because of that. Right now, you have choice. 12-126 specifically states the city will pay the full cost of health coverage for every employee, retiree, and their dependent up to the HIP HMO. So that's why we did not support 874. It took the power out of your hands to choose, so that if the MLC and the mayor said, you know what, Ms. Nina, you live in Oshkosh. We're going to have all people that live outside of the New York City metro area go into managed care. If you live in New York, you could have this plan. If you live outside of New York, you have another plan. If you, for example, if you chose the Aetna Medicare Advantage plan, which right today you can, there's 2 Aetna MA plans. If you live in New York, New Jersey, and Pennsylvania, you have co-pays on just about every service. If you live in Florida or one of the other 13 states, there are no co-pays. That's what would happen, and that's why we were against it. This kept choice in your hands today, and that's why we fought that.
Now, I also want to add a little bit more to that answer. The other issue with Intro 874 was that it allowed you to have choice, but at a cost. Now, Ms. Nina Tribble, I'm sure you make a very good pension. Maybe Vinny Gaglione makes an even better pension. But many retirees don't make a lot of money in pension. For example, we have top paid police and firefighters that were top pay in 1979, and their top pay was $15,000 when they retired. They take a 50% pension. It was just under $8,000 a year. With cost of living adjustments of 1 to 3% compounded over the decades, their pension today is just under $26,000. They cannot afford to pay $200 a month person, which is what 874 was going to charge them. And that was not going to stay, knowing with inflation that they would never be able to afford their health care, and they would only be able to be in a managed care program that was touted as free. They would have an inferior plan simply because they weren't as wealthy as you or some others. And that's not fair, because that's not what they were promised. It's not what we were promised. So you all at that table at the city council on January 9th of 2023 testified that you should have a choice of healthcare, which you should, but you were advocating that you wanted the choice that you could pay for, where the rest of us would never be able to pay that. And I want to read you 874 since I have it on my phone now. So it says the city will pay the entire cost of health insurance coverage for city employees, city retirees, and their dependents, not to exceed 100% of the full cost of a HIP HMO on a category basis. And category is individual and family. Here's where the change came in, Nina. Comma, or in the alternative, in the case of any class of individuals eligible for coverage by a plan jointly agreed upon by the city and the municipal labor committee to be the benchmark plan for such class, not to exceed the full cost of such benchmark plan as applied to such class. Now, why did that concern us? See, and this is where you needed to follow our litigation, because forever, the city has been paying up to the HIP HMO for all of us equally. And approximately, that number is about $1,000 a month a person individual and about $2,500 a month family. Okay? The city and the municipal labor committee, yes, including Michael Mulgrew, agreed to let the Medicare Advantage plan be the benchmark plan. And if you don't believe me, you can go back to the original documents that came out of the Bloomberg administration and the de Blasio administration that's in the 2014 UFT agreement and the 2014 MLC agreement. This plan by your leader and the municipal labor committee, convincing the municipal labor committee, was putting the Medicare Advantage plan as the benchmark plan for those that were Medicare eligible with a dollar value of $7.50. So you know what that means, Nina? That means that the Medicare Advantage plan or the HIP HMO VIP would both be free because they were $7.50 or less. But any other plan that the city would offer, you would have to pay. We were never, ever told we would have to pay for healthcare like that. We all had access to healthcare at the same benchmark. To now say that if you're elderly or disabled, the only thing the city will pay for you is $7.50. But if you're 64 or 60 or 59, the city will pay up to $1,000. Why? You didn't even understand what they were saying, and yet you defended it. You and I, when I met you that day, you shook my hand and you said it was great to finally meet me in person, and it was great to meet you in person too. And then you said to me, I'm the opposition. And I turned around to you and said, no, you're not the opposition. We're on the same page. We both want our senior care. The difference is you were willing and able to pay for it, and I can't. That doesn't make you the opposition. I'm here to educate you. You wanted your senior care, and so did I. I also know by the law and by what was promised to us over the decades, you should never have been forced to pay for that. Your union leader said that you could have whatever you want as a pay-up option. Why is that okay for you? You were promised that plan for free. We were promised that plan for free. I'm not going to pay for it. And that's because I can't. I have retirees that make $10,000 and $12,000 pensions. They will never be able to afford a premium of $200 a month for a plan that only pays 20% of their medical bills. That's why, Nina. That's why it's important that you understand what you're arguing for. And when someone tells you, call city council and tell them to blah, 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 you need to understand what you're telling them. Look into it. This is what was so frustrating to us that you didn't understand. And I don't mean you as in you personally, as a whole. But hey, I get it. We were always taught to trust our union leaders. And at this point, you were misled. So the moral of this story is Intro 874 offered you choice at a cost, but you'd always had choice. You were told you didn't have choice. Guess what? You still have choice today. So clearly, someone wasn't telling you the truth. Choice is negotiated by the MLC, the unions in the MLC, and that's a whole nother video because the MLC has no right to be negotiating unless the unions in it choose to negotiate as a coalition. The MLC has no bargaining certificate. Every union, it is a mandatory subject of bargaining, healthcare. So please understand, this is why we fight. Because otherwise you're creating classes of haves and have-nots where your wealthier retirees will have better health care than those who don't make a lot of pension. And that's not fair. We were promised equality and equal access. And that's what Medicare gave us too, which is why that was one of the greatest civil rights benefits ever. That it gave people, no matter what your color of your skin or your income level, equal access to doctors and hospitals around the country. Plan that you're trying to say I should be accepting of would limit me the doctors and the hospitals I could see simply because I'm a poorer retiree. And that's not okay by me. And it's not okay by our members, of which one day I hope you would be one. Thank you for the question, Nina. And it truly was a pleasure to meet you. I know you're not the opposition. The only thing I would say is you're just misinformed. And I want to help you understand so that you are informed because knowledge is power. And you know that as a teacher. Have a great day.